I'm Dr. Patricia Arian. I am a professor at the University of Washington, and I co-direct the University of Washington Alacrity Center, which is a center funded by the National Institute of Mental Health focused on improving access to psychosocial interventions to underserved communities. My research has focused primarily on reaching historically underserved communities with behavioral interventions, and in the past 10 years have been using or looking at digital platforms, apps, and tools to help increase that access to care. Today, we're going to have a moderated discussion. My panel members are Dr. Jonathan Goldfinger, Dr. Kenton White, and Dr. Ursula Whiteside, who we heard from this morning. Full bios and CVs can be found in today's attendees packet. This session will be approximately 65 minutes, moderated discussion asking panelists for actionable suggestions to social media and tech platforms, particularly how to respond to individual users or populations at low, intermediate, and high risk for suicide. And so we've, just as by way of summary, we've heard a lot of really useful information that touch on all of those points today. And what I'd like to ask the panel members to do is to think about what we've heard today and how that might inform what types of interventions tech companies or even regulators who might be informing what tech companies should do in some future generation to mitigate to mitigate suicide risk at these different levels. So I'm going to start. It's an open discussion. I will encourage the audience to send questions if you want to ask questions of the panel, and I will read them to the panel members and have them respond. So what I'd like to do is start with Dr. Goldfinger and get your impressions as to what you heard today and how companies could be might need to do to better address suicide risk in this country.
Thank you, and thank you to the organizers for having me. So I'm the CEO of DD Hirsch, the largest provider on the National Suicide Prevention Lifeline, soon to be 988. And I can say, having been with DD Hirsch throughout the pandemic, where we all kind of rolled up our sleeves to try to get something done, and also with a background in tech entrepreneurship, it's a little surprising that the companies are not at the table or are not as closely working with all of the incredible scientists and researchers we've heard from in these webinars. And so I put my business hat on. Right. And I think, well, why? And I think we've heard inklings of this. One, the proprietary nature of their software. This could be financially lucrative to them and a competitive advantage. I saw an article was shared where we see that Facebook's users are kind of tapering off the last few years. So the transition to the metaverse, maybe they're intending to provide some sort of intervention. That's virtual reality. And if they know the algorithms, they know that that's what's coming. Right? Just one example. And so I think we really have to focus on how to financially incentivize these companies, which means, we in the nonprofit and academic and government space tend to do things out of the goodness of our hearts. We have to do it out of the goodness of their bank accounts or their shareholders. So that means convincing, Mark Zuckerberg or Meta shareholders, convincing Google shareholders, convincing Reddit, convincing now Elon Musk, right, for Twitter, that there is a financial benefit. And I think that, to me, is, yes, we can have regulation and accountability, but if we really want partnership, creating some form of mechanism where we can accredit or certify these organizations, these companies, for the quality of their suicide prevention algorithms and or interventions. I would say the researchers that we've heard gave great examples of what metrics could be used to show value. That would be one of my first recommendations.
Great, thank you. And Dr. Kenton White?
Hi, it's great to be here. Thanks for everyone for organizing this. One of the things that struck me from the conversation today, I'm an AI researcher, not a clinician. And I was hearing a lot of the conversation was about community and how the different communities are, you have to treat them differently. You have to have people that are culturally sensitive to them, culturally aware, and that a lot of our data is trained on communities who look like me and many of the other panelists that are here. And one of the things we've been working on, and that really struck me because we've been working a lot with Indigenous communities in the north, northern communities here in Canada. My colleague who should have been here, he has to actually be on the reserve because there was an incident, and he has to be there to help make sure that intervention and treatment is being provided. And so we know from this that the ways of doing detection between the general population and the Indigenous communities, the way we have to train the AI and what the AI is looking is so very, very different. And so if we've got an algorithm, something with Facebook that's trying to be individualized and work for everyone, my own experience is I'm really curious, are we going to have something that is focused on most of the triggers that college students are having, from Indigenous communities are having, because their triggers are very different. Their triggers are things like residential schools and truth and reconciliation and all of these things that we would never see as a trigger among a more white general population. And so that's one thing that really struck me. And the second thing that struck me was, we're all focused on the individual. Part of this panel has been about the population level. And I know, like, it's great we've got Didi Hirsch here. It's great that in the US we have 988. Wouldn't it be wonderful if we could have people who could tell when something was going wrong in every community, in every school, so you could know that it's not just an individual, but it's providing, just letting them know I'm here for you. Now we can't do that. My colleague who I mentioned earlier, he's got decades of experience. So when this event happened on the reserve, he said, I can't make it because I know I have to be on that reserve because I know people are going to be in crisis. What if instead of trying to be at individuals and intervene and call 911 or now 988, instead we could say, hey, Didi Hirsch, this school right now looks like it's at a higher risk. Why don't we just be there so that individuals, and we heard that from LA County, that most of the time if you just talk 88% of the time, we can intervene. It's just making sure we're there when people need the help. And that's the other thing that struck me from today's conversations, a different way that AI could help rather than calling 911 for us.
Great. Thank you, Kenton. Some really interesting points have been raised, but before we move on to those, and I ask you those questions, I'd like to hear from Ursula Whiteside about her perspectives of what happened or what she heard today.
Yeah, great. I think this continued discussion about, what happens immediately in the moment, what makes sense, how do we tailor an experience, in contrast to where social media companies are right now and the resources that they have and the connection that they feel to us. And that I do have hope. I know that these organizations have individuals who care very much about this. And part of it, with what my outside assessment as a person with lived experience and a researcher and a psychologist is, they really need the structure. They might not agree, but the structure and the support to do this work. And that I think I'm really curious to think, to know what other people's beliefs are about this, of like whether or not it makes sense to create some kind of federal legislation around what's expected across social media organizations of a certain size around content specific to suicide, and whether now is the time to begin those efforts regarding transparency expectations. We saw that Meta posted, how they came to, or some of the specifics around their risk algorithms, but the average person wouldn't know where to find that or what to do. But how could we, create some expectations that will put everyone on the same page. And I think, organizations that are owned by shareholders aren't going to spend money unless they have to. And in this case, it may make sense for the federal government to require these organizations to set aside a certain percent of their budget to mental health and to helping with this type of situation, these type of situations. So that's my thought, and just sharing my slide on that topic.
Hey.
Thank you very much. So what I've heard from your comments about like what should happen with the tech companies, what recommendations they have, I heard a couple of things. One is sort of the where and who should be responsible for providing the intervention, who should own and see the algorithm, to make and who's responsible for being to act on a risk. And this is also a topic that came up in other presentations. I'm just going to open it up to the three panel members about, further, because Kenton had mentioned, maybe the algorithm, for instance, or the intervention should really be that these companies have a way of flagging somebody, for community who's at risk so that the community can intervene, or a known entity where there's trust and support, could be the one responsible for that. I'm curious to hear from John and Ursula, since that was Kenton's, hill he was on, what your thoughts are about that use of this information or these algorithms. Yeah, sorry.
I think it's a great idea, and it's similar to what I would recommend next, which is that social media companies really do need to partner with 988 facilities and crisis centers. It's one thing to partner with the National Suicide Prevention Lifeline, but if you ask the average person what that is, some of them think it's some call center, maybe outsourced somewhere, because it's called national. But the truth is, something we've learned in the last years with 988's arrival is very few people know that 988 crisis centers are actually local community-based organizations. We are predominantly nonprofits in your backyard providing crisis services, suicide specialized care, mental health services in the case of Didi Hirsch. Dr. McKeon mentioned Centerstone and others. If people thought of us as a community-based organization, and this is some of the work we did with the National Alliance, I was on one of those task forces and really kind of message to people that this is a local community organization. If they understood that, then this would be very different. The people of Los Angeles know Didi Hirsch. They don't know 988, even though 988 comes to Didi Hirsch in Los Angeles. And we're the largest provider in California and in the US. We also have the Disaster Distress Helpline. We're one of the largest providers doing chat and text, and one of 3 doing the Spanish Lifeline. And we're growing thanks to significant funding from the federal government and the state of California. So if people knew this was a local community organization, like Kenton said, this is who's coming, but that would mean you'd have to, the companies would have to be able to geolocate these individuals, right? And they'd have to be aware of who are the local trusted entities. Now, right now, my sense is that all of the organizations like Didi Hirsch that have largely been doing this work unfunded on the Lifeline since its inception are trusted community organizations. I don't know how you measure that or prove that, but my sense is if social media wanted to, we in Los Angeles, the folks in Houston, the folks in Phoenix, all of us on large 988 crisis centers would immediately be willing to work with them on the local communities and the hotspots Kenton refers to be there for them, to be the instant connection made if they knew that they were in our catchment area. So that's my call to action for all of these companies. Didi Hirsch will always be a partner to you, like we have been for the LAPD, LA Unified School District, the NFL crisis line, you name it. When they come to us for an innovation, calls, chats, texts, what have you, for suicide prevention, we are there, and we welcome that partnership and ability to pilot this in real time. We can turn it on like that.
Okay. Ursula?
Yeah, I'm coming back to thinking about what people have expressed what they want, people with lived experience. And, the themes that I often see are, I want the people that care about me to reach out to me. And that's not available in all cases. Many of us, when we're really suffering, have pushed everyone away in our life. And also this, desire for transparency, so that if I want to know how it is that they sent me this message, that Facebook sent me this message, I can get access to that information by clicking that little button that's on the screen that popped up. Want to know how we found you? It's immediate access, and that transparency is so important. And so around whether these algorithms should be publicly available, absolutely. And that's the kind of thing that I think, and I'd love to hear people's thoughts. I feel like I'm the only one talking about legislation, and that might mean that I'm completely off. But I would love that the organization have the support that that's just what you have to do. And so we're all at risk together in this. We're all in this together. So those are a few of my thoughts. The importance of transparency, for sure.
I don't mean to. I just want to jump in on the legislation, because I was just at an AI conference last week. And one of the big talk is, so the EU is putting in this legislation. It's coming out of question period or response period, and they expect it will be law in 2 years. And it's around all AI to basically give it something equivalent to the CE mark, so that it has to be reviewed and proven and go through the government process to get the CE mark before it can be used in Europe. And that'll probably be law in 2 years.
Yeah, I totally concur with you, Ursula. I think this has to be the carrots and the sticks. There's no question that Congress is increasingly looking into this in the United States and applying pressure, but we also have to understand as advocates how powerful the for-profit lobby is. Doesn't mean it's insurmountable. But we're talking about people that probably have way more money than any of our organizations combined exponentially, right? And so the politics of this are enormous. The lift to get there is big, and I would encourage the National Council of Mental Wellbeing and others, SAMHSA, to get into that fight. And I think at the same time, it behooves us as researchers to also be constantly trying to network and connect with those good actors at these organizations, these companies, who really do often move from tech company to tech company. So often, now there's like a little network of them keep trading from Amazon to Google to Headspace, what have you, right? And we've got to engage them. And I want to include in these organizations, I think this is really important. There's a tendency, and I've been guilty of this too, to sometimes vilify some of these organizations. I'll just pick on them because I know them, and I really do love the new leadership at Crisis Text Line, right? But in Facebook's own document that was shared with us earlier, they said they work with Crisis Text Line, right? They're not working with the 988 Center, they're working with Crisis Text Line. Recently, Crisis Text Line's really been working to improve the equity, diversity, and inclusion efforts over there. They shut down one of the, questioned for-profit use of data, right? Thanks to public pressure, but they still serve an enormous amount of young people at risk today. So Crisis Text Line should be on this discussion. They should be able to say, yes, that research does work compared to our AI research, or it doesn't, and if they can be a bridge to some of these tech companies, because they often behave like a tech company and how they're funded in a lot of different ways, they could be a great bridge. And I think there are some others. So even as we see the negative media attention to some of these organizations in this space, when we know the good actors, we have to go and encourage them to find ways internally to bring their organizations to the table and in partnership. And I think of JACO, if you know the history of the Joint Commission, right, it actually included the hospitals, the American Medical Associations early on. They did not create a quality standard for healthcare without healthcare, right? So if we want quality standards for social media and big tech, they have to be at the table for it to succeed.
Personally,
that's exactly where I was going. Is like I'm talking about this legislation, but I'm seeing a million horrific ways that something like that could go that would just make this more impossible, less useful. And of course, that inclusion of the people who are actually, running the show behind the scenes of social media is incredibly important. I think about my home state, Minnesota, where Amy Klobuchar is a senator there, and how, there's always this talk about legislation around social media companies and what will happen next. And it's a challenge, that's for sure.
A question related to this topic from the audience is tech companies seem averse to the legal risks in providing software program that is responsive to suicide prevention interventions. A presenter last session discussed how Microsoft dropped a project because of this threat. How can this be addressed, and what are the legal risks? Anyone?
No, I don't think we have a lawyer at the table, right? But if you're required to do something by law, like say as a healthcare provider, the standard of care, right, is to ask about suicide, to provide safety planning, and to follow up with caring contact. And if I don't do that, and I'm documenting in my electronic health record, and I don't include that in there, then I'm at greater risk. So if the legislation says, hey, you need to be doing these things, when people say, I'm going to kill myself right now on Facebook, if you're not, you need to do these things and you need to document it here, then their risk goes down. They're following the law, and ideally we're helping them be at less risk.
Mm-hmm.
I'm not going to talk about the legal, but I will talk about a recent incident here in Ottawa a few months ago. In Canada, we don't have 988, unfortunately. So any calls that involve mental health go to 911 and go to the police. And a few months ago, we had a mother whose teenage child, was in distress, and she was worried, and she called the police. They called 911. The police were sent, and the police tried to do their intervention, and the child was really scared and ran off, jumped off the balcony, and died. Probably not suicide. It was just fear of the police. And this is now leading to civil suit against the police, because why did, in a call that should have been a mental health call, did this child fall off? And that's just one incident in a small 1 million-person city, and the liability there happens. And then, so from a tech company perspective, they read these things and it makes them scared, because if you're Facebook, you're not dealing with just 1 million person, but 1 billion person user base. What does that look like to them when we see that cities get sued all the time for mishandling in intervention? And I think that's what they see without being a lawyer. I think that's their perspective. I don't know how we as a society can help alleviate that perspective.
I think you actually hit the nail on the head of how to alleviate it, Kenton. In Los Angeles, Didi Hirsch is pioneering, as Dr. McKeon said, 911 diversion program where the LAPD and Didi Hirsch created an algorithm. This is part of the alternative crisis response Dr. John Franklin Sierra was talking about. I was one of the co-chairs of this initiative, where we figured out a way that he was showing you some of the algorithm for calls that were mental health crises or suicide related, that were not an imminent threat to the public, can be transferred to Didi Hirsch. But as part of that process, Didi Hirsch 988 is transferring it back. So I think the answer is teaching social media to partner with 988 instead of 911. Their algorithm has to tell those people that the imminent risk case goes to 988, not 911. And like I said, I know the crisis centers across the U.S. would be happy to work with them on an individual basis on, pilots that will show, like we're showing with the LAPD, that the officers never need to be deployed.
Mm-hmm.
And then, we in our pilot, we started out 8 hours. Within a few months, it was so successful, the city of Los Angeles and Chief Moore and the LAPD funded it 24/7. Like that. It was so effective, and we're still refining it, and we're still refining it, and we're finding that we're disproportionately serving Black and Latinx young males. Some of the highest risk category there is today for suicide, right? So we know it works. And I think if we teach the social media companies, call 988 or essentially chat and text 988, that matters. And I think another thing is that they have a lot to learn from us as well. So our data on which medium to be the intervention shows differential uses of call, chat, text based on age, race, ethnicity, and even LGBTQ identity. So we actually know what they prefer if it's deemed to be an imminent, suicide, acute, high risk case, or a mental health crisis. We have the data showing that some of them want a text message based on demographics Facebook has, right? Some of them, or TikTok in this case, younger generation. So we have that data. So if they knew that we were that sophisticated and we're able to partner, and an officer, when Didi Hirsch is called, we do not deploy officer or ambulance 96% of the time. With their volume of users who might be subject to this algorithm, that's a significant risk reduction compared to their current algorithm. I'm pretty confident of that.
Richard, McKenna, did you want to say something? Your microphone's off. I'm on, sorry.
Yes, so I certainly agree with John, about what he's saying about how these algorithms should point to 988 rather than 911. And some of the exceptions are likely to be straightforward to incorporate, for example, that there's a suicide attempt in progress. And certainly no algorithm is going to be perfect, but by and large, I think the outcomes are going to be a lot more favorable if we can have this directed toward 988. And then we have the potential to begin to track more closely on what happens with people afterwards. We know, for example, in some of the Lifelines evaluation studies, that follow-up calls and texts and chats are actually well received by most people who feel that they're life-saving, or that it has helped them not take action to kill themselves. The VA is to be credited for really having done the most significant study on mortality after contacting the Veterans Crisis Line. But even there are undoubtedly different pathways that we need to understand better. So data to fill in some of the gaps that we have, rather than just assuming that the current system is the best that we can do, even though we don't have any real data to support that.
So in the time that we have, I want to shift. We've been talking a lot about what to do in the higher risk situation. We do have a question from the audience that I think would orient to some of the discussion around low and moderate risk. And so the question was to you all is, I'm wondering about more upstream or preventative protective factor development. What research efforts, or even I think too, like tech company or a community practice work is being done to better understand what and how protective factors might mitigate risks, so you don't have to get to the point of calling an emergency. Further, how might social media be leveraged to enhance protective factors and their influencing or mitigation of risk factors? And that is for anyone who wants to answer.
Well,
Yep, go ahead, John.
No, you first.
I can speak to the theoretical, like having worked with some of these social media organizations while at the University of Washington, we explored all sorts of ideas and, were shot down or tried or whatever. And, including things like, one of the commenters mentioned this, using advertising to essentially provide resources to family members or friends who had a friend who'd posted content recently or in the past or something like that. So there are absolutely opportunities for interventions that we haven't imagined previously. The time, money, resources, and devotion, like ongoing dedication, I think is what we struggle with as well.
Yeah, I was going to say I'm a pediatrician, and the protective factors literature and research is still pretty nascent in general of what protects people in life with their health, their mental health, and their ability to thrive in education and jobs. So I think we have to support that ecosystem and that growth. Part of my research is in intergenerational trauma, and we talk about ACEs. Some people are calling them PACEs, because you can also have positive childhood experiences, which early research is indicating are probably the buffers of the toxic stress that leads to the damage in the neurology or the brain that creates the environment for, especially young people to die by suicide when later life stressors arrive. So the protective factors research is coming, and it's there. But I haven't seen it much in the suicide prevention arena, short of social emotional learning efforts in schools. I would say that's one of the most significant efforts I've seen, but often these are separate domains. They're fragmented. So when we think about what Dr. Wilcox was saying about connecting the data systems, right? GoGuardian is surveilling for negative stuff. What if it's surveilled for positive factors, right? And we said to GoGuardian, hey, we really want to research this. That's a great project. And I haven't really seen these protective factors efforts talking about suicide as the outcome, but it should be, certainly should be. And I would suggest that we heard from Phil earlier that Friends, right? I was talking about video games, but Friends, Meta will love the video games one. If you tell Meta that video games are a protective factor, they'll get in on that. But friendship, right? Friends are a protective factor. So it comes back full circle to what those with the lived experience have shared, and what we're saying, that social media companies should be encouraged to figure out whether, if they somehow alert subtly a family member or a friend that somebody needs additional support, love, outreach, right? If that makes a difference. Because friendship, safe, stable, nurturing relationships are inherently a protective factor throughout life and for almost all health and mental health risks.
Right. And in conversations I've had with companies, they often gravitate to efforts and projects that resonate with their mission. And Meta's mission is social connection. And so if that were sold to them that way, perhaps that might make it up the ranks. Ursula, did you have something you want to add?
Yeah, I just, in terms of thinking about next steps, I mean, there's this opportunity around intervention, around social modeling and social learning. And, historically, we've talked a lot about the bad things that happen when there's media where suicide is shown as a solution and there are graphic methods. But there's newer research that indicates that, when someone describes a personal story, including pain and suffering and suicidal thoughts, and then also described maybe that it wasn't perfect, but they got through it, and how that can be potentially protective effect. I mean, that's stuff that we could really use in the social media arena.
Kenton, I want to have you have an opportunity to say something, and I want to wrap this, fold this conversation into a question that was for you. So in the spirit of thinking about, preventative factors or early prevention, low, moderate risk, how, with the communities that you've been working with, has there been work there? And the question that was sent for you was, wondering about the cultural dimension of Indigenous people and how these algorithms or interventions are able to identify markers that are culturally attuned and responsive to the different worldview and lifestyle that they may have. And how have you been thinking about that kind of across the intervention spectrum?
Yeah, that's a great question. And I'll, from the protective measures side of things, what we're finding with Indigenous communities is that one of the being engaged, not just with the community, but with events that are going on around, are one of the biggest protective factors that we've seen within northern communities for helping them. And in terms of how do we find the different factors, it's, well, I think we're all saying the same thing. It's working with the actual communities, it's working with the people who are on the various reserves who are trusted, and working with them to help identify what are the cultural factors that we do need to take into account, that we do need to look at. And it's a slow process. We've heard a lot about, I really loved the work that we talked about earlier about the topic models and doing the bottom-up approach. And that is really great for an unsupervised learning approach. Unsupervised learning means I give the AI data and the AI figures things out. In our work with Indigenous communities, we've just not been able to get that to work because they're so underrepresented and the data is so small that it takes even longer time. It takes a very iterative effort of collecting data, seeing what we get out, and then reviewing it with a team of people who are there on the reserve and can go through and say, this is culturally important and this isn't. And that's sort of where we're at. This is an ongoing project, so I don't have all the answers, but we're learning and that's our process for learning and how it's very different from working with the general population.
Okay. So let me shift to a different system, a different group who hold companies accountable. And it's sort of related to a question that came up around the use of school counselors to help, if you have something like GoGuardian, imagine, the intervention may have gone to the school counselors, or I'm not sure if it wasn't clear if it was that, or they went straight to the family, but how could they be leveraged, particularly, and I think, John, you may know more about this than I, that there's been strong interest in the state of California around how badly COVID impacted the high school students who were supposed to be in college. Many of them are not because of the disruption in their school, in their education, and then the stressors that the college counselors have been identifying as new students roll in and drop out and all of that.
So California has, under Governor Newsom and Secretary Galley, a very robust children and youth behavioral health initiative. And it's highly aligned with a massive restructuring of our payment system called CalAIM. And this is basically because in California, historically, county governments have been the payers of record for those with severe mental illness or a crisis, and these governments pay at cost with no margins. So this is essentially, in my mind, discriminatory financing, because those people are not, or those of us who serve those people do not actually have the ability to grow our services for them. So there's a huge restructuring going on in California. And so the Newsom administration has pumped a ton of money, interestingly, into schools to enable schools to do things like this, and including schools to become like the payer of record. So they would subcontract out or pay their own counselors more. And so we have an initiative called Community Schools. This is a big initiative in California to kind of create comprehensive mental health and crisis care services as part of holistic services for food, housing, other essential needs within our school systems. And the Newsom administration has really pushed that happen. So I think California is going to be a unique test case for the United States, where schools become very robust mental health systems. And what happens when they're that close? And we partner closely with a national organization based in LA called Teen Line. And we've been working with them on growth strategy, which is very exciting. And one of the things we've heard from the schools is, what if it wasn't just that a teen was listening to a teen, as they do, crisis care for teens by teens, which is a wonderful peer-led model. What if you could even deploy teens in the school or families with lived experience around that neighborhood to be there instead of the school's security officer or often police on college campuses? So I think the future of mobile crisis response and a drive in California to be highly focused on peers, those with lived experience throughout the entire crisis care continuum. We're very big on this in Los Angeles and California. So you're going to have a lot of these opportunities to see it unfold in schools in really remarkable ways. Stay tuned.
Any other comments about the use of schools in this space and how potentially combining social media and school-based records as a means of identification and mitigation?
Well, I wouldn't trust the social media companies with my kids' school records, so it's just me.
I think it would be the other way around.
Okay. But I think they would want it to get their data.
The back and forth, probably. Well, in the last 2 minutes that we have, I just wanted to move into the whole issue, again, of privacy and data sharing, just really briefly, and see if you have any comments. One of our speakers today, Dr. Reznick, raised the question that instead of the seriously uphill battle of changing what social media companies do themselves via persuasion or law, why not use the less hefty lift of requiring that they make it possible for consenting users to easily provide access to their data, to which they already have legal rights, to third-party organizations. And then we create consortia building from the participants in this workshop series and other folks, where the focus on getting the work done and not in twisting arms. So what are your thoughts on that in the last minute that we have? And I'll just kind of go around each of you. Let's start with Ursula, because I started with you last when we started.
Yeah, I'm just thinking any route to do anything important and big here is going to be painful. And hopefully you have the right people in it with you. I'm not sure what the best way to do it is.
Okay, Kenton?
I think it's a great idea. Working with data, I would, I think it might be very, very challenging for the third parties to be able to have all the data privacy implementations in place that would be required for sharing that data.
Okay. And John?
Agreed. I think it's a brilliant idea. I would encourage whoever tries to take it on to work with major celebrities and influencers. We've found in our suicide prevention fundraisers that when you have Selena Gomez share a post about suicide, you have an enormous amount of people sharing current risk, future risk, protective factors, all of the above in the conversation. So I think if celebrities that had massive followings that care about mental health, like Selena, Michael Phelps, and others, the Royals, if they were part of it and they asked their followers to do it, that would probably lead to a greater volume of data than going to the tech companies and asking them to support this.
Great. Well, thank you very much, everybody. This was a really wonderfully rich discussion. I think the whole day has been fascinating. And if attendees weren't here at the first workshop, that's online. And that was also a very interesting and really useful workshop as well. And this has been a great follow-up. So now, thank you very much, Ursula, Kenton, and John. It was a real pleasure being your moderator. Very easy job for me.